Right, are you ready?
So we are recording now. So I'll just do a quick introduction and then hand it over to you guys. So Oncology are here, the wonderful team of health and wellbeing in oncology are here to present what's been going really well for them and their staff in that CSU over the past 8 months. Would that be fair to say? Yeah, yep. Super. So over to you guys.
Lovely. Thanks, Claire, for inviting us along. So I'm Sally, I'm one of the matrons in oncology and I'm the health and wellbeing lead for the CSU. And I brought with me today Becky. I'll let you introduce yourself.
Hello, I work on 87. I'm currently doing my nurse training and I'm the health and wellbeing champion on the ward.
Lovely. So we're going to share a quick presentation just about our journey really in the last kind of 8 months. So bear with me while I hopefully can do this. How to get rid of that now. Oh no, this is going all wrong, isn't it? Right, let's go to slideshow. We got it. Can you see that?
Yep.
Lovely. So just moving on to the first slide, let me know if that's not moved on. I was just going to give you all a quick overview of our CSU. So we are a large cancer centre that works within LTHT and has around 1,600 members of staff working in it. We're mainly based at St James's, but we also do provide support to Wharfdale, Leeds General Infirmary, and a lot of our clinical teams will actually do outreach work. A lot of the consultants go off and work in other hospitals within the region. So we're a diverse workforce covering a wide range of specialties, and in terms of the types of staff that we have working with us, we have health scientists, engineers, radiotherapists, oncologists, surgeons, haematologists, a huge amount of admin and clerical staff, research nurses, clinical nurse specialists, physicians associates, advanced clinical practitioners, our unregistered nursing workforce. It's a wide range that we cover. In terms of the clinical areas that we cover, we've got 9 inpatient wards. We have a 4-bedded thoracic level 2 facility. We've got specialist theatre suites in breast and brachytherapy theatres, 2 large day case areas that can see anything from 80 to 100 patients a day in each area, 2 outpatient areas, our regional radiotherapy unit, and a number of laboratories that support with results testing and histopathology. So we're a big CSU, and previously within our CSU we had a health and wellbeing group, and we'd done some work on trying to establish some health and wellbeing champions, but attendance at the group had started to dwindle. We'd lost really oversight of what was happening in local areas, and we stopped really focusing on this in 2019. In March 2020, I ran a health and wellbeing day, approached organisational learning, and we ran a day over at the Bridge. And this was a really successful day, well, I hope it was anyway, where team leaders, senior managers and health and wellbeing champions were invited to come along and listen to many topics, including the menopause, men's mental health, mindfulness. And that really got us thinking again about our health and wellbeing and gender within the CSU. But I remember vividly talking about the COVID and all the news and whether the day was going to run at the time. And very quickly, the pandemic struck and kind of things came to a bit of a standstill in terms of bringing people together to talk about things like this. A huge positive from the pandemic was the amount of staff support, though, that was really on offer. And I think the way this was communicated, what was on offer to staff, was a real positive from the pandemic, and it was really well managed from a central point of view in terms of the trust comms. But we still within the CSU probably didn't have that oversight on how individual areas were approaching, what support they might need, and just to check in really that it was being thought about. So we met with Trust Health and Wellbeing team, and obviously Claire as well started IMPO, so you were a really useful link for us to join with Claire. And we decided to re-establish our monthly CSU meetings, and from that we ensured that we had the right representation from all areas within the CSU. The aim wasn't complicated, it was very simple. We just wanted to get the conversation going and to hear how things were and to provide support and advice on how people could embed the health and wellbeing agenda at a local level. So it really was a really simple kind of message we were giving. And within the first 2 meetings, we agreed what our health and wellbeing objectives would be for the CSU, and I'll go on to those in the next slide, but you'll see again that these were simple things that everybody could achieve. We did establish a separate health and wellbeing meeting for our medical teams. That was with HR support. They had some different needs, and a lot were around their trainees and their health and wellbeing needs at the time, and so it felt that they needed a separate forum, but that we could share information across both forums, and that's worked quite well. So as you can see, these were the 5 priorities that we all agreed as a team, and like I say, they were simple things that we didn't want to put people off thinking they couldn't achieve these in their areas. So we wanted all areas, wards, departments, our med physics engineers, they were all going to be the same in that we all wanted them to have at least one health and wellbeing champion who was going to push the health and wellbeing agenda in their area. We wanted each area to, again, to have a mental health first aider so that you'd have a dual approach. And then we wanted all new starters to the CSU to be given an introduction into the health and wellbeing, to say what was on offer. I know they also get that from the trust, but that we also cared about it as a CSU and we're here to help. We wanted areas to think about how they signpost, so when they're not on duty, or if for any other times it was clear signposting for what supporters of support were out there, and also the health and wellbeing team share regular updates on what's on offer, so just to display those with their team, and that we would have, as a CSU, have oversight and support those that are doing the do out in the clinical areas. So once we'd agreed the objectives, we then set our monthly meetings for the year so that they were in everybody's diaries. We invited team leaders, managers and health and wellbeing champions, but actually our focus wasn't as much the health and wellbeing champions. We knew they were already keen and wanting to do the role. It was more about ensuring our team leaders were discussing the issues, what support were they giving their champions, were they aware of everything that was happening, and to really kind of get some ownership from them on this issue as well. And it was a great forum for sharing good practice. So we have had guest speakers come along, we've had staff psychology, we've had chaplaincy. Last time we had Leeds Hospital Charities to help people support areas with their bids that they might be wanting for fundraising. And we also did a mindfulness session about how you can make mindfulness work when you're in a busy clinical environment. We have rotated the meeting chair between departments. So there was myself, there was our senior service manager within admin and clerical, there was our radiotherapy teams. They've all taken a turn because everybody brings a different perspective to health and wellbeing, and we didn't want it just to be dominated by one person. I think really important at the beginning of the meeting is that we allow areas to feedback on how things were. Initially, as this was starting out, it was very much a checking in and how are you doing kind of approach. But now we are trying to hold people, not to account, but to say, you mentioned this last time, how are you getting on with it, and to try and keep the momentum going with any ideas that they've got. Currently, at the moment, we have 30 health and wellbeing champions and 36 mental health first aiders. So we've made a really good start in trying to ensure that all areas are covered with the 2 roles that we wanted in our objectives. But there's still areas that perhaps have gaps, and we'll keep an eye on those and support those areas to find health and wellbeing champions. And it's been really useful having Claire attend our meetings when she can, and also James can attend from HR, just to give that perspective from your point of view, updates on where we're going as a trust, but also so you can hear how things are for our teams and what you might need to do differently as a health and wellbeing team to help support as well. And we have incorporated an introduction to health and wellbeing on all our formal inductions now for new starters, which has been well received. So moving forward, I am leaving the post next week, but that's not a bad thing in the sense of it's always good, I think, to pass on the baton for these lead posts, because people come with fresh ideas and can help keep the group energised. And so Laura Turner will be taking over, and I know that she's interested in establishing a menopause support group forum for the CSU as well as one of her first ideas. We'll keep working with our champions, and we'll keep looking at how we signpost and how whether they need support to do that in their areas. We want to keep it simple. The littlest things can have the biggest impact. Today is cake day for us on our floor. We've got a number of staff that have got different allergies, need gluten-free, nut-free, and today it was my day, and I made sure that I brought in a nut-free cake, a gluten-free cake, and that everybody was included, because people can feel excluded very quickly if you don't take into account kind of everybody when you're doing these initiatives. We will support areas with their health and wellbeing initiatives with their bids with Leeds Hospital Charities. We've got good links with them. We've just put in a bid to create a staff support stroke wobble room on level 5. So we want to convert that for use for all of the CSU. And I know a number of areas are looking at having their staff rooms done. We'll monitor the success of any initiatives and look to roll those out across the CSU. So it will continue to be a forum for sharing good practice, and we'll keep on with the support for our champions that are working so hard in their areas to promote this agenda. And the other important aspect of the role is showcasing the brilliant work that our champions to do. And this is why I've invited Becky along to join me with this talk. And I'm going to hand over to her now to present her section.
Hello. I just included a little brief slide just to introduce myself really and the areas that I've worked in. So when I started for the Trust about 5 years ago, one of the Band 6s approached me about 3 months after starting and asked me if I'd be interested in the health and wellbeing stuff. Based on my background education, the places that I've worked, so I've done volunteer programs abroad, I've worked with people with learning disabilities, the elderly. I've got a counselling degree, which really sort of facilitates my communication skills, I think. And now I've worked for the Trust and I've done a Band 3 role. I did that for about 3 years before starting my nurse training. So I really think as an all-rounder and a person very much on the shop floor, I think that helps me to really engage with the team. And all the experiences that I've gained, I think, make me quite a compassionate and understanding person. So I try to use what I've gained through my experiences to really help support the team and the patients. But with a happy team comes happier patients. So that's kind of my motive. And the slides that I have prepared, they sort of focus on more of the bigger milestones that we've achieved on the ward. But actually we do things all the time, every day. And I try to lead by example in the hope that the things I do, people pick up on and they're more likely to do it themselves. So things like when we had the crazy heat wave and it was absolutely scorching, I brought in loads of ice lollies, not just for the team, but for the patients. And we all sat and had an ice lolly in the afternoon. And sometimes it's just those little things, as Sally's already mentioned, that really do make the biggest difference. It shows that you've considered your team, that you care about the well-being, that you want them to feel good. And we do all sorts. We do sort of refreshment afternoons. We make sure that we keep our team hydrated. It's the simple things of noticing that somebody's not drank much, so refilling the water bottle so they've got some cold water. You know, it really is about the little fundamental things. And in order to achieve these ongoing goals of improving well-being, that fundamentally does come from a good management team that makes the time to allow me to attend meetings, to sit and print out loads of little booklets, leaflets, things like that for signposting, and they are very, very good at that. And I would stress that that is quite an important factor in being able to do this well, because I need their support to be able to make the time to do it. So the things that we have done, we do have a health and wellbeing board, which is just a little bit of signposting, which is such a fundamental aspect of the role. And it includes a model of reflection to try and help process sometimes what is a very stressful job. And there's, you can't see it very well now that it's smaller, but there's the 5 ways to wellbeing on there, sort of motivational things, motivational quotes and things like that. But the important aspect of it is that it's not about always being positive. It's about how we manage things when life is not sunshine and roses. And in a job that is very, very stressful sometimes and very busy, it's how do we manage those emotions? How do we support each other to be able to manage those safely and ultimately give our patients really good care? So I also put together a health and wellbeing booklet, which has just got resources in it that are available to staff, things like the simple things like using the staff gym. And sometimes it's just signposting to probably things that we use in our daily life, that it's not just about work health and wellbeing that I focus on in general. So there are free apps that can be used that I personally use, which there's one called Medito, which offers guided and unguided meditation, stress relief, anger management. It has all sorts of things. It's free. So that booklet includes things like that. It includes models of reflection, keeping a reflective journal, ways of sort of expressing what you're feeling and how to manage it. So I've done that recently, and my aim is to update that sort of, I'm going to aim for about every 3 months, so I can do it in bulk as opposed to constantly, you know, save the trees, as opposed to constantly doing a new booklet. Another thing that we've been doing on the ward, which came as a suggestion from one of my appraisals actually, as I approach the end of my qualification and I'm about to be let loose in the wild, I was thinking about different ways that would make me feel in control of my workload, that would prevent burnout, and I suggested colour-coded teams on our ward. We're quite a busy outpatient department and we don't have certain bays that certain nurses oversee. It's kind of a whoever's available goes to the next patient sort of system. And what I suggested was to have certain bays that were colour-coded, and then as patients come and they sit where they prefer to sit, so we still maintain the person-centred approach to our patients, we then allocate that coloured bay to that patient, and then a particular nurse and healthcare assistant oversees that coloured bay, and it helps relieve the load a little bit in what can be a very busy environment. It makes staff feel a little bit safer in the fact that they know who they're looking after and who they're documenting about, and it gives patients more continuity of care as well. Another thing that we've done, which is relatively new actually, is that we've started to decorate the ward. Very simply, nothing crazy, but just little bits of decoration and art therapy, which can be massive in helping reduce pain, stress, depression, and it also helps patients just be distracted from their illness in a space that they can feel very out of control. It gives them a sense of inclusion, and it's a bit of fun sometimes. So I'm doing a seasonal decoration at the minute. So at the minute it's all sunshine and flowers and like sunflowers and things like that I've done. But it's just including patients in cutting them out, deciding where they might look nice. Not only is it a bit easier on the eye, it's a bit warmer, but it just gives them something to do. It's another form of escapism from their illness. And staff have actually commented on it, saying that actually it's quite nice to walk down and see nice pictures. Sometimes, again, just simple little things. So my aim is to go through the seasons and do this, and eventually do different themes. Another aspect that I am focusing on, being a student myself, is to improve the student experience on our ward. With orientation, I want them to feel welcome, expected. I've been out on placements and people have not been expecting me to be there, and it's quite a daunting, nerve-wracking experience anyway, working somewhere that you're unfamiliar with people. So it's nice to feel expected, orientated, you know who you're working with, you know how long you're there. So we've put together a student board, which I know is a trust aim as well, to have a student board on every ward. So we've done that. I'm also putting together a student pack, which sort of highlights all the different areas that they can gain learning opportunities in while they're there. Again, a bit of signposting. And the aim really is to create a good experience for the students, so in the hope that they might come back and work with us, and you know, boost our nursing team. And just to touch on what Sally said earlier, we are trying to increase the amount of mental health first aiders on our ward as well. I'm signed up to the course coming up, and I think there's a small number of other people that are going on it as well. And again, it's all in the hope of being able to recognise when people's mental illness might be deteriorating, recognising the signs and symptoms, being able to signpost and being able to support with a safe and non-judgmental environment available to all staff. So that's kind of what we've been doing so far. Sorry to bombard you.
Thank you, Becky. I'll stop sharing if anybody's got any questions.
Just amazing. both of you, well, all of you, the whole, I know it's been a massive collective effort. I am going to come to questions. I know there's only a few of us today, but just be thinking if there's anything that you think you really want to ask in terms of how it can work in your CSU. There's a couple of key nuggets in there for me that really stand out. So the first one was around you've invested in your leaders rather than your champions and got them on board so they can support their champions better. You talked about getting the basics right, and often as a champion, that's all we're asking you to do is to support that. To those small things have a huge impact. And I really love the bit around actually involving patients in some of this. You can kind of create that capacity as well, because you're going to support your patients in any way you know how, aren't you? But by doing it in a way that you've thought about it in that art therapy, you're helping staff in the process with their own well-being by doing the tasks that they need to do in terms of their job roles, which I think is fantastic. I've just got one question which I know is probably burning on everybody's mind, and it's the question that I get asked by quite a lot of people. So it's to both of you really. So the first question is more practical one, Sally. How much time have you been allocated to lead on this? And then the same question to you, Becky. I know every champion will have a different agreement with their line managers, but how much time have you been given, maybe weekly, monthly, to be able to do some of this work?
Shall I go first then? So I don't think I was given any time specifically. I think it's, as we all know, sometimes in our roles, more and more gets handed over to you, doesn't it? And I think it can certainly feel very overwhelming. And maybe for a while there was a bit of a delay in trying to think about how we can approach this, because it felt overwhelming. You can feel responsible for the whole of the CSU. And it was only really when I kind of thought, no, I need to break this down. It's about how we support others to take it forward, and what do we want to achieve. And so I think the starting point was just getting the meetings in the diary, that then dedicated time, and then you obviously then put time aside to prepare for your meetings. And it's just continued in a natural flow of the week before I prepare for the meeting after. And we've cut the length of the meeting down, so it's not as long, because it was an hour and a half, and we've managed to kind of get it to an hour now that we're familiar with things. But I think having that structure and not feeling overwhelmed. And I know other colleagues have said also that because the information that comes through can come through quite regularly, again, that can feel a little bit overwhelming. So actually they put aside in their diary an hour to go through, update, and then send it out in bulk. And again, that's just another strategy that kind of has helped.
And what about you, Becky?
Again, I suppose very similar to Sally. They haven't really allocated a specific amount of time to do it, because we.
Oh, I think they're frozen.
Okay.
Oh, you're back. Sorry, you just froze for a second there, Becky.
Oh, okay. Sorry. Yeah, when we've got a meeting to attend and I just let them know that that's been booked in, they're very good at working around that. They're usually not very long, so there's always some way in which we can sort of cover it between us. The art side of things and the practical side of things, in putting booklets together and things like that, that very much becomes a team thing. So it's not always just on me to go and take time out. You know, if it is a particular busy day and I'm really hoping to get it done, our ward clerk was really big in helping me put that booklet together, in printing it out, and sometimes it's a matter of staying a little bit later than I probably would have done, which is absolutely fine. It's not an expectation, it's something that I would choose to do. But they are very good at just letting me go off and do something and covering. They do see that it's such a big part of managing in nursing. Anna's a very good manager in that way. She sees the bigger picture, and she's very fair in that. And again, it's a team thing. Even decorating and putting things up, I can grab a spare 10 minutes. There's always little lulls in the day, so I just utilise my time usually.
And I think what you're saying there as well, isn't it? Like you said originally, it's a team approach. It's not just it all falls on your lap for your team. If you can engage everyone, engage the leaders like you talked about, and they've got a real strong emphasis on this, then actually every little helps, doesn't it? And it creates amazing work. Just to note as well, you've got 40 mental health first aiders now. I got the data yesterday. So if you've got more booked on, wow, I mean, you're just flying with that. Any other questions? Be mindful I am still recording because I think it's useful, but if there's any other questions anyone's got, go on, Tracy.
Hi, that was amazing. I think it's fabulous what you've done. One of my questions though is funding. Where do you manage to get money from to be able to do these fabulous displays and, you know, like to put the artwork up and things like that? Because I did our second health and wellbeing meeting since we started yesterday, and that was one of the questions. People wanted to know if we're going to do this, how we're going to pay for it.
So far it's been a bit of a, I've just kind of done it ad hoc, and I've done some on the ward, I've done some things at home, and brought some things in. It hasn't really had a solid plan on that. I haven't gone through a particular avenue, I've kind of just done it. I just kind of took the reins and did it. So going forward, yeah, there obviously will need to be a plan, because it's another thing that costs, isn't it?
Tracy, you might want to get Charlotte Self from the Leeds Hospital Charities to come along and speak at your meeting. We had her come along.
Charlotte Self.
Charlotte Self. If you email the team the generic email address, Charlotte probably will reply back. And she came and spoke to the team, and they spoke to us about supporting bids going in, because they're very much supportive of health and wellbeing initiatives or renovating staff rooms, and also then the fundraising colleague came as well if your team wants to fundraise for these, because it's not an unlimited pot either, but they are really supportive of health and wellbeing initiatives. So, and everybody said it was a really useful presentation that she did.
Okay, so I can build on some of that as well, Tracy. So my response back to the health and wellbeing group would be, what do you need funding for? So we have funding to, you'll be seeing it coming soon. I've mentioned it before. We're in the final stages of the health and wellbeing staff booklet being sent out to every single member of staff's home address, but also we're going to have extra made up so you can put them on notice boards and things like that. Likewise with the roadmap, we will have enough for every team, so enough for 700 notice boards. We've also got a little bit of funding to do some financial leaflets. We've just been approving them this morning actually, so we can put a bit of an emphasis on what's available for financial help. We've also got a very small amount of funding, which won't go very far, to start doing some wellbeing boxes to send them out to teams, where we're going to put some of these leaflets in with some support from the charity, with some of the nice little gifts and stuff going in there. So we're doing that as a trust, and that's the purpose of these meetings, to find out about them and ask for them. So my response would be, well, what would you require funding for? What is it that you want to do? And absolutely, any applications under £5,000 doesn't have to go to a panel at the charity. It just gets reviewed on like a weekly basis. I think I want to say weekly, maybe monthly. So you do get quite a quick response, or they'll come back and talk to you about how you can do it a bit differently, or how you can link in with us as a team, for example, if it's something we're already doing.
Okay, because I think one of the things you mentioned yesterday was actually notice boards to be able to put the stuff up on. Because they were saying, do we just order through normal channels, or is someone going to pick us up on it? So yeah,
we've just ordered notice boards through normal small works requisitions, but we have just put a hold on them at the minute with the current financial position. But normally we would just approve it through the ward budget or department budget for the extra notice board going on.
Okay, thank you, that's really helpful. Thank you very much.
Thanks, Tracy. Are there any other questions from anybody else? Feel free to put them in the chat. Okay, I'm going to stop recording then.